Hello, Adele Mollo. Can you hear me?
Yes, I can.
There you go. It works. Happy days. I'll mute you now. You can rest easy. We'll just give it a couple more minutes and then we'll kick off. Okay, it's a couple of minutes past 2, so I think we'll kick off. I think this is the third of the sessions, so hopefully it'll be as interactive as the last two. First of all, I'll start by acknowledgement to country and paying my respects to the custodians of the land on which we're meeting. For Western Health Sites, that's both the Wurundjeri and the Boonwurrung people of the Greater Kulin Nation. But as we're virtual today, like many days now, it might be meeting on many Aboriginal lands. So I want to pay my respects to Aboriginal elders past, present, and importantly, those emerging. Today, we're going to use the Q&A function again, if you can, which makes my life easy because it's only one of the mini screens to juggle. If people use the chat, I'll try and get to that, but if you can use the Q&A, that's easier. I thought I'd start with some non-COVID stuff first and then move to COVID stuff in the second half and then open up for question and answers, hopefully. The first one is to say that my beeper, which some of you may have forgotten about, which was a kind of casualty of COVID really, is back on the agenda. So watch this space for some organisational communications about how you can download the app and then use it. It's an entirely secure messaging system that we can use in Western Health to have chat functions, and it functions very much like WhatsApp, but it's much more secure. And probably early in the new year, although we'll confirm this, there will be an opportunity for photographs to be taken and linked directly into the patient's EMR. So that will hopefully be of use to significant groups of clinical staff in Western Health. To actually augment patient records with photos for wound care, for home visits, for equipment, etc. Staying on the systems piece, Sue Bruce and her team have been working really hard with Sandy Shute and Co. to reimagine the WeLearn platform. Some of you may have loved and seen the older version. We're about to launch a wholly new and improved version that's much easier to use. So all of our training packages will be done through that new portal. And hopefully that will be much easier for people to use and navigate through. So again, watch this space for information coming out for that, but a lot of hard work behind the scenes to make that a much more usable product and a much more sort of reaction one than we've currently got. In October, we were supposed to be holding our Research and Best Care Week. Obviously the COVID restrictions mean that that's just not possible. So Paul and his team have made a call that we'll be doing it virtually. So I think it's still a great opportunity for us to showcase the huge amount of work that we're doing both in a research and quality improvement sense at Western. And hopefully people will find that useful to dip in and out of through Zoom sessions. And again, more information to follow on that with a program coming out soon. In relation to New Footscray Hospital, a huge thank you again to all of the clinical staff and staff generally that have been involved in the scoring for that. I sat through a monster all-day Friday session looking at the product of all of those subgroups that we've been involved in and many more around the scoring and evaluation of the 3 bids that have been put forward from the bidders. It's fantastic to see the hospital take shape. We have 3 very good bids in front of us, and any of the options coming forward will be a great outcome for the hospital. And hopefully in the not too distant future, we'll be able to start to confirm, where we're at and start to show the designs of that once all that becomes public and the deal in effect is done. But I think we're going to get a great outcome from the process, and I think a facility that both the staff and the community and our patients will really be enthusiastic about and enjoy for years to come. Community Chef continues to progress. A lot of work is being done behind the scenes to get ready for the staff to transfer to Western Health. And again, there's a huge amount of work that Deb Hill has been doing in the IR space to transfer and offer contracts and things, and Joe DeBono and his team. I think we're at 55 contracts issued in a day to those staff after a lot of consultation and work. And we're still on track to move the Community Chef staff across, hopefully as soon as we can. And the Melbourne Health staff also coming to Western Health is on track. And probably we're still on for a November end of production from Altona, with the closure of the Footscray production kitchen at that point. So still a very hectic space, but a lot of great work going on, and the Community Chef team are working hard to plan and develop the menus that we can then bring into both the health sectors as it stands at the moment, but also then look to try and expand that to other and new customers. So still huge opportunities in the Community Chef space, and the team are working really hard with the Community Chef colleagues in Melbourne Health to really be enthusiastic about that change and the opportunities that brings us. Want to also welcome some new arrivals. We've had Rowan and Joe join us as new Dons for Footscray and Hazeldean, and they'll be on the Zoom and things, so many of you will have seen them, but great to get some new team members in. But also today to acknowledge the fact that we're losing a team member. It's always changing at Western Health, but Adele Mollo has took on a new job, sadly for us, but great for her, as the Director of Testing for the Department of Health, and she's going to spearhead the COVID testing plan for DH. And because it's a pretty critical role, as you can imagine at the moment, the DH asked that Adele be released relatively immediately. So she leaves us on Friday to start her new role on Monday. Although knowing the way it goes at the moment, she'll probably start the new role on Saturday, but don't tell her that. But a huge thank you to Adele for the great work she's done in just over 5 years, I think now, as a divisional director, and some significant achievements that she's put in across that for Western Health, Women's and Children's Directorate. And I'm sure you'll be greatly missed, Adele, and on behalf of the team, all the very best in your new role. And health is a very small world. I'm sure we'll see you around. Moving on to COVID-related things. It's one of those ever-changing pieces. It feels like it was back in March, where every day is dynamic and fast-paced. What I do want to do, though, is start with a bit of a disappointing story just to share with staff. You may have seen it or heard about it, but we had a video surface on YouTube. Somebody who had wandered into the ED at Sunshine. I think they'd been in there before, but that's just my supposition, and recorded their visit from the car park pretty much into the new ED environment, into the main ED treatment space. They recorded talking to some of the clinicians, and they generally were sort of, not being very supportive and or transparent in what they were doing. And there's also been a bit of a voiceover that then suggests that this was kind of yesterday, and no staff are wearing PPE because back in March that wasn't the requirement. So that's triggered, disappointingly for us, not that we've got anything to hide, but I think it's just a bit of a shame. WorkSafe are coming to site to have a look because they think we're not following the PPE directions, which clearly is not the case. But at that point in time when the video was likely to have been shot, there was no PPE as there is now, because the guidelines were very different back in March. Anyway, we'll deal with that, but it's just to put that out there that disappointingly, somebody in our community came in and videoed, unknowing to staff and patients, our ED and cubicles and staff. So that's out there, we'll deal with it, but just want to make you aware of that. We're also have had a Safer Care Victoria visit. As I said last time, we're still waiting feedback from that, but seemingly it's fairly positive that we were doing the right thing and a good job, but we'll wait for the written word on that one. We've also got another visit happening today from the Department of Health outbreak team. So for those of you that are unaware, Ward 3B at Footscray has had an outbreak following the admission of a patient that was asymptomatic from a home that didn't have any cases that we knew of. That changed the day after admission, and that patient was positive and asymptomatic. And that's led to, I believe, 4 or 5 members of staff now as a result, and 5 patients. We're watching that situation very closely, and the DH have come in to have a fresh pair of eyes, have a look at our procedures and processes to see how we can improve, if we can improve. So it's always a very hectic space with visits. And sadly for us, our community need us to continue to care for them in COVID cases because it continues to escalate. And we're currently looking after 20 inpatients that are COVID positive and about 75 suspected as we sit here right now. The wearing of PPE continues to still be a bit of an issue, I'm afraid to say. I know from talking to folk and from observing things, and I do challenge people when I see it, that people still aren't wearing the PPE in accordance with what we're asking you to wear in open spaces and in clinical spaces. So I'll see people with masks on but no eye protection, or I'll see eye protection and no masks. This is a very, very nasty bug. It's very, very infectious, as we're finding out and have seen before. And I really, really am keen that staff protect themselves as much as they can by following the PPE guidelines and putting on the right PPE. We know from some of our exposure to patients that are asymptomatic, they are very, very, very infectious. I can't say that enough. Too many verys, probably. So just watch the space and follow the guidelines, please, on PPE. It's your responsibility to wear them if they're available and make yourself safe at work. And to that end, I'm grateful to our illustrious TikTok crew, the Sunshine Joan Kerner Theatre team. They've done another TikTok video that I think is being released later today or early tomorrow, following the success of the last one that they did. And this one really is poking a little bit of fun at, well, not poking fun, sorry, it's a serious but a funny take on PPE. And I know from talking to other CEO colleagues around town that are not anywhere near as busy as we are with a COVID load, that they're creating sort of, opportunities for people to challenge safely and with humour people that are not wearing PPE properly. So the one I heard about recently is the Alfred Hospital, who've got a Kapow campaign. Those of you that are as old as me and can remember the sort of Batman and Robin things from the sort of 70s, when they used to put the big cartoon bubbles up on the screen with Kapow and all that kind of stuff in, they're basically doing that and pointing out the fact that people aren't wearing PPE. So rather than borrow the Westerns, borrow Alfred, I'm sure we can come up with a Western equivalent to have a bit of fun, but in a serious way, tackle the PPE behavioural stuff. So I'm happy for answers on a postcard. Someone did suggest paintballing guns to shoot at folk that were not wearing PPE, but that seemed a little bit over the top, so we're not going to go with that one. But if you've got any thoughts or ideas about how we can challenge PPE adherence in a sort of fun way that will hopefully track behaviour, the TikTok video might help, but answers on a postcard, to me, that would be great. And as I say, all suggestions welcome, preferably less violent than shooting folk with paint guns though. And I think that's probably about all I was going to say in terms of an update. There's a fair bit of ground covered, and I'm happy to throw it open to questions if folk have them. I'll bring up the various question screens. So we've got one that is asking about contact tracing, and have we had any discussions for a more centralised contact tracing between different Victorian health services, especially for healthcare worker infections? There are conversations ongoing, but actually it's not going to be centralised. It's going to be decentralised is the sense that we've got at the moment. At the moment, there is a sense around the fact that the regional services have been very good at doing the contact tracing because they've been doing it remote of the central DH service. And therefore it's been pretty responsive and very quick at jumping on outbreaks in a way that gets right at the heart of community. So you may have seen last week the Premier's announcement about a suburban response team. It's pretty likely that the west of Melbourne will get at least one of those suburban response teams, which is going to be an outpost of the DH Public Health Branch working with us and other agencies to do that contact tracing, a little bit like Barwon have been doing, for those of you that are aware of the Barwon model around the Colac area. And certainly from what I hear, although I don't know a lot about it, we're going to find out more in coming days, I think. They're modelling this on the New Zealand and New South Wales approach that has a very locality-focused public health model that is much more nimble and on the ground than in those hard-to-reach communities doing active work on the ground. And my sense is that these will be enduring, not just for COVID, but long term around how do we get better public health support into those hard to reach communities. So I think watch this space for that. And Barwon certainly have reached out to say if we need any help with contact tracing, then they're very happy to do that. So hopefully that answers that question. And I say watch this space for more information on the suburban response units. One suggestion for non-PPE adherence is a gold coin donation when caught. So that's a thought. We might have virtual money though, because not many people carry real coins about these days. But thank you for that suggestion. We'll add it to the list. Someone's asked a question about the new symptom screening app. Why can't daily attendance be combined into this app rather than need to manually record it? So if you're using the app, then you don't need to do the paper attestation. You only need to do one or the other. So if you're doing both, then there's no need. If you're doing and hopefully most of us are now using the app to do that because it's pretty easy and quick. That data is stored electronically and we keep it for 6 weeks as is the requirement. And that's really to help contact tracing to know who was in and who wasn't in at the time rather than poring over rosters and EMR feeds. So if you're using the app to sign in, then just use the app. You don't have to sign the bit of paper because you're attesting that you're on site and you're symptom free, and that also clocks the fact that you're here. And you only have to fill that in if you're coming into work on the sites. If you're working from home, there's no need to do the attestation. But again, a huge thanks to Kate Bramwell and her team and a few of the helpers behind the scenes that helped set that up in remarkably quick time. I think it's a great innovation and one hopefully that people are okay using and are finding quite helpful. We still have to do the attestation, so please be under no illusion that at the moment you can stop doing it. We have to attest individually daily that we are symptom free and are coming to site not having been in contact with anyone that's had a COVID test, has COVID symptoms or have symptoms ourselves. So yeah, please continue to fill in that attestation. It's really important and it's one of the things that in both of our visits so far, the Safer Care team and the DH Outbreak team have looked for. So it's really important and is part of the directions that we're working under from the government. So thank you for raising that one. Any news on elective surgery? It's a popular question amongst CEOs with the department, as well as I'm sure it is amongst staff. At the moment, we don't know is the honest answer, sadly. There is discussions that the elective surgery process may mirror the steps coming out of lockdown, and there will be a very gradual approach to starting electives. So I think from memory, we're doing about 50% of our normal elective load, give or take, with the urgent Cat 1s that we're doing. And the sense is that we will be allowed to creep up very slowly with elective work, probably in 10 percentage point jumps. So my sense is that if we can get into a stage 3 position, we'll get a 10% allowance. And then each month, as long as the numbers hold, we may get a further 10%. The last I heard was possibly a sort of 85% number by December being possible. But that assumes no, wave 3 or anything of that nature. So I think electives, as we go, we don't know what we don't know yet, sadly. So I'm sorry for all those staff that are chomping to get back to normal duties, and also for our patients that can't get the elective surgery that they're waiting on. It is a significant growing problem. There is a lot of people that are not getting care that are on waiting lists, and those are growing. There's also worrying a large number of patients that aren't seeking out diagnosis because they're scared to come in. So there's a real concern about folk deferring care. And I know that from the work that we're doing, there's a significant amount of emergency surgery activity that's happening. My sense is it's probably about over 100%, maybe as high as 130% of activity. And we're seeing in the hospital, people are having falls, but sadly for us in the community, an awful lot of patients, particularly elderly patients, are falling. They're breaking hips, they're fracturing and breaking ribs, and doing some serious damage to themselves because they're not in their usual support modes because people can't go and see them or visit. So I know the figures are pretty hectic, so thank you for all the work that's being done around there. And as I say, watch this space for the electives, because we'll get more announcements, but it'll be tagged to the lockdown steps. And I think we'll be restricted from doing normal operating for quite some time yet. If you don't go inside the hospital, do you have to do a daily attestation? No. So if you're not coming to site, you don't have to attest, because you're not at risk of spreading the infection in a work environment. We only have to do the attestation at work because we're a permitted business, as they call it. So in that sense, if you're coming to work at Western Health or any one of our sites, you have to do the attestation either by the app or on the paper, but only one or the other. But if you're not coming in, then that's fine. Will the workplace declaration form, where people outline which other workplaces we work at, be used as part of contact tracing efforts? Yes, if you work in other workplaces and there's an outbreak, either there or here, we use that to do the contact tracing for close contacts. I know one of the other hospital services has had to do that recently. Some of its clinical staff worked in another facility, and they became COVID positive as a result of the work in that facility. They were unaware that they had the virus and had worked a shift in another hospital, and that led to a lot of contact tracing around that service to understand where those people had been and who were a close contact and who wasn't. So all the information that we have is used only for contact tracing, and if we don't need to use it, we don't use it, and it gets destroyed after that 6-week period, as per the government requirement. But so that's why we're doing it. That's why we have to do it when you attend a work environment that's a permitted business, and it's used for that purpose. So hopefully that's clear. So I'm just checking the chat function because there's a few things on there. No. Is Western Health still assisting with other hospital? Not quite sure what that question is, but I can give you a stab. Western Health is still doing a significant amount of work in the aged care sector. Our Resi InReach team continue to be really busy and supporting probably about 25 homes again, sadly. Some of them were ones that we had supported previously and we thought had turned the corner, and they've now got new infections. We have gone in to support through what is called a notice to agree, Wyndham Lodge, and we're also likely to go back into Florence this week with another notice to agree to support Florence. Jeff Gall did a fabulous job there for 4 weeks. He left for a week and we've been asked to go back. So we're into 2 aged care facilities at the moment, over and above the work that the Resi InReach team are doing. And that still remains a very hectic space for that team, who are doing great work under huge pressure still. We had thought we'd turned the corner, but it looks like there's been some new outbreaks and some old outbreaks flaring back up again. The other thing the question may have linked to is around Djerriwarrh. So at this moment, there is no conversations about a potential amalgamation with Djerriwarrh. They've been put as a pause whilst the wave 2 kind of wends its way, because there's a lot more things to be doing than chatting through that at this point. But we have had confirmation from DH that when we come out of wave 2 and life returns to a semblance of normal, those conversations will recommence. And we will look at the opportunity for a potential amalgamation with Djerriwarrh down the track, but that's getting a little bit further away than it once was. We thought that we'd probably be doing that by Christmas. My sense is we probably won't do that, if we do at all, until June of next year. If I was a betting man, by the time we finish the consultation piece, prepare all the board papers and decision issues, and then move on from there. The only other thing to flag that question may have raised is around Melton Hospital and the 2 community hospitals at Point Cook and Sunbury. We continue to do a lot of work on the planning for those, and Susan Wardle and her team are heavily involved with colleagues from the DH and the Victorian Building Authority to see how we're planning to shape those particular assets and facilities going forward. and that's quite exciting. It's also pretty remarkable that as a hospital service, we're doing so much building. It's entirely unique that nobody, I think, has ever wrestled with the fact that we're potentially going to build 2 significant hospitals almost back to back, having also opened up Joan Kirner, building a new ED, putting in an EMR, and doing 2 community hospitals. The scale of what we're being asked to do is huge. But I think it's a great recognition to the hard work of staff over a number of years to raise the need for things in the West, and now we're kind of getting them all at once, which proves a huge amount of headaches, but in a good way in a logistical sense. But it's a real reward, I feel, for the teams at Western Health who've advocated long and hard for these facilities and services, and the community that we serve who desperately deserve and need them. So hopefully that gives you a bit of a rundown on all things hospitals. There you go. I think in any one of those I answered some of it, so thanks for that clarification. There doesn't seem to be any more questions at the moment, so I did want to acknowledge the huge work that our ED teams are doing, particularly the Sunshine ED with the mental health load at the moment. It is a significantly stressful time in the community and in the organisation. They're very different times to normal. Just walking around the place in PPE is very different to normal. And we're seeing significant increases in mental health presentations in our ED, or in our ED, sorry. Sunshine is taking the brunt of that with a significant number of long stayers already this year. So this is patients that stay longer than 24 hours in our ED. And that number staggeringly already is at 71 patients that have breached that milestone. And that's a real concern to the leadership team, because that means that we've got very, very distressed mental health patients needing a service in entirely the wrong environment for significant time. You know, once you get over 24 hours, they're staying usually upwards of 30 plus hours. And that's not a great environment for someone who's in mental distress. Our teams are trying their best to give best care, but they're not mental health practitioners, and the mental health services are significantly stretched. So we are escalating this to DH. I think Tash feels like it's almost a twice daily exercise at the minute. But you know, it's not a great environment for care at the minute, because patients are very distressed. They're shouting, they're being restrained, they're fighting with each other and others. So we are trying to find some solutions to that, but it is particularly challenging at the moment. So a huge hats off to the teams that are putting up with some really, really poor behaviour from patients that are in need, and particularly to our security guards who are trying to support the clinical colleagues and are being injured in the process, which is also resulting in another WorkSafe visit because of an injury to a security guard over the weekend. So a real melting pot of challenges. And as I say, last week was Are You OK Day on the 10th of September. And I think, you know, internally amongst colleagues, please ask folk if they're okay and they're travelling well. I know there's the Carinish service for employee assistance. So if you're feeling slightly under pressure or want someone to talk to, reach out and use that. The pastoral care team are also a great resource as a listening ear. So please don't bottle things up, seek out help and support from colleagues or others, because these are very different times. And it's a very unusual situation where the normal social support in a hospital is somewhat jilted. You know, colleagues will usually support each other in the tea rooms, chat, and we're not really lending ourselves to be able to do that very effectively in the new guidance around PPE. So, you know, really appreciate colleagues asking if folk are okay and supporting them and reaching out. Our community are doing it tough and the mental health burden is increasing. We're part of that community, so our pressures, I'm sure, are the same. So, as I say, reach out, seek support, talk to your colleagues, talk to EAP. There's plenty of help out there for folk that need it and want it, and a listening ear is always good. It's kind. So someone has said that these meetings have been useful, so that's always handy. Glad to hear it, and again, I'm happy to keep running them for as long as folk want them to come along. So hopefully, you know, interactive is helpful, and in the Zoom environment, it makes it pretty handy for folk to ask questions. Are there any further questions that people want to raise? No? Okay. Well, in summary then, I'll ask folk to have a think about the Western health equivalent to the Alfreds and others kind of Kapow type campaigns. Answers on a postcard. Please stay well. Please stay safe out there. Please remember to wear your PPE accordingly and appropriately. It's really, really important that you keep yourselves safe because that protects your families. But also it's important that, you know, we can provide care to patients and have our staff do that, you know, rather selfishly. But I'd much rather see you be safe and okay for the cost of a surgical mask and a face shield than get COVID and often be ill. So as I say, please wear the PPE, enjoy the TikTok video, and thanks again to the Joan Kirner Theatre team for doing that. Hopefully you'll have a chuckle like I do when I watch it, but also understand the message behind it. So thanks all. Have a great day. Stay safe, and I'll see you again next week. Thank you.